Welcome back. I've jumped forward because the last one's all about the PPE gear, which you do need to know. I want you to go through it, a combination of it. I want you to get some gloves like I mentioned and learn how to take them off correctly. We want to do this in class with you, but the more practice you can get in your workplace, the way better it's going to be. And you're going to be doing it. There's no doubt about it. You're going to be wearing gloves and gowns and you're going to be wearing masks. So please practice the correct procedures. There's photos in there you can follow as well. Okay, moving on. I'm just going through your worksheet and your assessment so I can give you as much information as well. It asks you there about how do you know if a wound conditioning is worsening? Many reasons, eh? So they can start to become quite a foul odour. That's when it's got quite bad. That's actually should be lower down the end of the spec. That's when it's been infected for a while and it's pretty awful, especially like an abscess. That's pretty gross. Colour is a dead indicator. So communication and observations. Colour. First of all, if it starts to go red and spreads more red around the actual wound, if the actual inside of the wound is becoming more yellow than normal, most cuts will go yellow because that's the white blood cells fighting it. But then eventually they all should turn into red and it should heal naturally. But if they stays yellow and pus is coming out of it, you just need to be aware and how long and how much is coming out. If it starts to get infected, you might see like almost vessel lines coming around the wound as well. And that shows that the infection is starting to spread into the capillaries and the network, and that's not a good sign. Extra swelling and pain is also a sign that the infection is going deeper into the skin or wherever it might be. So you need to monitor it from day 1 and ask them day 2, day 3, how they're feeling, what's the pain levels, how much swelling is getting there. As you learned in class, once that, if it is infectious and it's started to go all around the body, we call that systemic. It means the infection has gone systemically and it's going around the body. If it's going around the body, your body will go into survival mode and it will raise your fever like that. It will raise your temperature to create a fever. That fever is trying to blitz the infection. Sometimes it can, sometimes it can't. Also monitor how long they've had the wound for. Is it not healing? A good rule of thumb, but everyone is different. 10 days, it should be starting to see a significant healing in 10 days. If not, you need to be starting aware of these other signs and symptoms or what's going on to report to the, well, it's already reported to the RNA, but you just need to be that extra pair of eyes and ears. So there's some how you know if the wound is infected, some of the OBS and certain procedures you need to follow. Going back to your workbook, it talks about the PPE gear again, when you're using it and for what particular task would you use it for. So that's just for you to fill out as well. Okay, now this was a bit of a tricky one because every environment is different. This one was the most relevant I could find to New Zealand, even though it is from the Department of Health in UK. It's very, very similar. Some sharps bins in some areas and some countries are red as well, but most of the time they're yellow here in New Zealand. They are yellow. Also in rest homes, some people's linen bins will be completely different colour to somebody else's environment linen bins. So like let's pretend Bob Owens, where you're disposing of linen, of all dry linen and soiled linen, their bins will possibly be a different colour to Mary Shepley and Whakatane. It's just how you've been taught and which bin goes where. So you need to learn and be educated that. But in general, this is the colour coding of most waste bins. First of all, you've got to find out what's the difference between general waste, infectious waste and hazardous waste. You can imagine that general waste is your normal everyday to-day things. Your infectious waste would be all your blood, your urine, your feces and organs and things like that. And then your hazardous waste could be all your needles, scalpels, catheters, possibly. So you do a little bit of all research on that, and I want you to fill that out in your workbook. So here's a general guide, but it's up to you to just do a tiny bit of research so you can get your heads around which colour goes where. And also it tells you a lot about, I've got a link on here about landfill, about where the infectious waste goes, where the general waste goes, and where the hazardous waste gets disposed of as well. It's in quite a different significant area. Well done, guys. Well done. All right, last but not least, this is asked back on page 7. No, I think it's on page I don't know, it asks you about disposing of spills. We've got this with the norovirus, which I thought was quite relevant to this day and age, and so forth. So here are the 9 steps. These are 9 steps. Now, you don't have to use these 9 steps like 1, 2. Obviously, 1 and 2 could be together. You block off the area. As you went to get the sign to block off the area, you also gathered your equipment as well. You're going to grab your PPE gear to protect yourself, spray the area with disinfectant, and then you will have some sort of absorption. So if it is vomit, or urine, or blood, there may be a type of salt or a type of sawdust or a certain absorption method that your policies and procedures use. It's going to be slightly different in different areas. So you need to find out what you're using in your work. Scoop up the disposed waste, normally with a dustpan and a squeegee or whatever it might be, or with lots and lots of tissue. Then you need to put it into the correct waste bin, depending on what it is. If it's vomit, it's going to be into the hazardous, infectious medical waste because it's body fluids, so to speak. Disinfect the site clearly. Make sure it's dry. It's got here place all your disinfectant gear into the trash bag, but you want to make sure whether it's blood, vomit, or urine goes into your infectious trash bags. There will be certain bags all labeled and so forth, but you need to find out in your own rest home. And then discard of the 2 bags correctly in the right place, in the right procedure. Cool. So there's a little bit of research on that as well. It'll only take you 5 minutes. Information is available everywhere, and this is a good website that I've got on top. All right. Oh, here you go. So it says here what to do. This is like a bit of first aid as well. Clean, wash immediately. Make sure you're wearing your gloves. Make sure there's no splashes and so forth. If there is, you need to flush it with water as much as you can. If you've got anything in your eyes, irrigate with saline. And really just honestly, as hard as it is, you need to be putting your water on your eye under cool running water. And I hope you're all familiar with your incident reports as well. So a risk assessment, we might look at that when we do a reflective journal. You want to know where they are. Not everyone's going to fill them out, but you need to make sure it's filled out for your own safety. Oh, little shards container. Those with diabetes, or you've been with people with diabetes, you'll see that should have one of these in their house if they're self-injecting. Also hormonal, if they're trying for children and they're on IVF, they have to inject themselves, they may have a shards container there. So you need to be familiar with all these certain waste disposals for infection control. You don't want to muck them up. I do remember a big case in the UK a couple of years ago where people were putting drug needles in normal waste bags, and a few AIDS was really rife then, or HIV, and it got prominent, whereas they had to clamp down and go through these safety precaution measures of putting the needles in correct bins and stuff. I did talk fast, but I can't imagine you wanting to be sitting down for long. I hope I'm just going to do a little go through of your assignment really quickly. So the first page is types of microorganisms, which is all your virus, your bacteria, your protozoal, your fungi, and you're going to write that down. What's a susceptible host? Someone with a low immune, the elderly, someone that's already got an illness, maybe the young as well. And how are they transmitted? As you know, airborne, direct contact, indirect contact, and so forth. So you know where to find those answers. How do you reduce infection? You're doing it now. You're washing your hands, you're wearing protective equipment, and if you are keeping well within yourself. It's all here on the PowerPoints. It asks you here, common infections that you could make infectious. Dermatitis. So dermatitis, people can be scratching, they do weep, and they can get infected. How are you going to limit that area? All right. So you need to do a bit of research, but it would be down to you wearing your personal protective equipment. It'd be down to you containing that area. It'd be down to you educating that person, or if it's yourself, on what to do when it is pussy. You don't want to be spreading it, touching people, lying on soiled sheets, so forth. Same with the throat infection, masks, keeping away from people, and gastritis is, we sort of call it the stomach bug, the stomach flu, and you can have vomiting and diarrhea all day long, and it's highly contagious as well. So if you can just do a bit of research on that, How could you make common infections that could make you infectious? How are you going to limit you spreading that? What actions can you put in place? Pathogen type: virus, fungus, bacteria, parasite. An example of them, make sure when it's virus, you put down coronavirus or influenza and how is it spread, and do that for each one. And then I've got up on a PowerPoint of 5 situations where you should wash your hands at work and when you're a support worker, and it's that person in bed with the 5 arrows. Okay, number 6, describe the steps of cleaning up floor spills. That was, I had the 9 steps on there that I've just literally gone through. But here I've actually got some answers in there where you need to add on to it. So warn others of hazards by putting up a sign, blocking off the area, verbal communication, anything like that as much as you can. Wear what PPE gear? Of course, you're going to wear gloves, apron. Depends on what's soiled down there. You could end up wearing boots. You could be wearing a mask and you may be wearing goggles if it's fluid that could splash, and so on. First, gently encourage on the wound and what to wash the wound with and dry and cover. That was just in the last slide there, so if you could just read over that. Check out your workplace policies and procedures for guidelines. Like I said, there is a variation in different industries and you need to be aware of that. Number 8, describe main signs and concern that a wound condition is worsening. We've just talked about that and it's in the past slide. Redness, swelling, pain, tenderness, pus, smell, colour, so forth. So I'm just explaining a little bit what it means, okay, what it means. So you do need to go in a little bit more in depth there. Types of PPE gear and when would you use it? It's a little bit repetitive there, but it's easy. Gloves, when are you going to use them? All right. Aprons, when actually may you be using those aprons? All right. So you're going to go through these and find when you would actually use them. Some of them will have the same example, but say why. Okay. Then we talked about general waste, infectious medical waste, and hazardous medical waste. Describe a process of how this is disposed of safely in a healthcare setting. This is you going to your policies and procedures. If you're not in the workplace, there is plenty of resources online, okay? Or get on that Facebook page and start talking to each other. There is a few that are not in the big industries, so you do need to be sharing your knowledge. And then once you share your knowledge, you can also then look online as well. So you're having lots of different references. Awesome. Patient hygiene and support, so like 2 tasks and the best 3 best practice techniques. So one could be showering and one could be toileting, and you're going to say about what you're going to be wearing, how you're going to prepare for what you are wearing, and what you need to wear to stop any spread of infection when you are doing either of these tasks. General things that most of you do every day, but I do understand there's a handful of you that are not doing these procedures because you're not in the environment, so you have to just do a little bit more research and share your knowledge. Now, what I have got on yours is 2 extra questions, all right? A little scenario. I don't want anything really long or that much in detail. It's just so I know that you are aware of what you need to do when infection control processes needs to happen. As talked about Mrs. X, who started to cough and then you went back there and she was coughing more than usual and the staff handover person was also coughing, and you're just going to find out what infection control measures you're going to use, what documentation you're going to use, how can you complete her personal cares with you being protected, and just think of the whole roll-on effect by you putting these things into play. Last one, just a little bit of a reflection, and it's the last 2 pages that you really get marked on mainly, as well as, of course, all of it, but we're looking at this as a summary. What have you done to enhance your infection control procedure yesterday, the day before, and the day before that? Just what have you done? Now, how many have you upped your hand washing? Have you taught your kids to hand wash? Have you stopped touching your mouth? Have you just anything, policies, any procedures that you've put in place, whether it be in home, in work, things you've seen going to the shops and supermarkets, and what you've told your kids, really, just so you know that we're getting it out there and we're reflecting on what we've done. All right, guys, I hope it's going to be hard, and I know online's not the best, but honestly, Lewis and I are here. We're on FaceTime, I'm on Skype, I'm on email, I'm on text, and I want you guys to get in contact with each other. It's going to be tough, but qualification is still so doable, 100% doable. Yeah, I just want to give you all the motivation and the best you can. Cheers.